This video is just going to be so much TMI. Hey everybody! I know I'm so far behind in filming this video. I am 24 weeks now and I'm finally getting around to filming my first trimester video. So this whole video is going to be weeks 4 through 14. If you know, when you find out you're pregnant, you're actually 4 weeks along. So we're going to cover weeks 4 to 14, and I'm going to try to make it as short as possible because I had so much stuff happen during the first trimester. And more than anything, I just want to document this for me to look back on and remember. But also, I think it might be able to help some of you because I had some pretty odd things happen. And so maybe if you're having symptoms, you'll find this helpful. In honor of my first pregnancy video, I am wearing my new mama shirt. It's got it in 3 different languages. Isn't it so cute? I'll link it down below, but as you can see, well, you might not be able to see. I'll show you my baby bump now so I can show you how far behind we actually are. Look at that. So you can definitely tell I'm past the first trimester, but it's coming right along. So if you've seen my only other pregnancy video, you will know that we did IVF fertility treatments in order to get pregnant. So at the 4-week mark, we went to the fertility clinic for a blood test. And the blood test was on a Friday, I believe. It might have been a Thursday. But the Tuesday before that, I just could not wait any longer. I had to take a home pregnancy test. And the Tuesday before my blood test on that Friday came back positive, and I just was in total shock. I could not believe it. The second line showed up within like 3 seconds, and I was just blown away. I could not believe it. So I took about 6 more pregnancy tests at home before we ever even got to the fertility clinic for the blood test. So needless to say, we kind of expected the blood test to come back positive. We were so thankful that it did. And if you know, with fertility treatments, they will have you back within like 48 to 72 hours for another blood test to make sure that it's not a chemical pregnancy and that it's progressing like it's supposed to. So we went back 3 days later and got a second blood test. The numbers were great on that, and we were just thrilled. We were so excited. This is what we'd been praying for, waiting for, everything that we had worked so hard for in our 2 years of trying to get pregnant. So I'm not really planning on making an entire video about our fertility treatments. It kind of was just a brief overview in that last video of what all we went through. But if you have specific questions, feel free to message me or write me in the comments below, and I will try to answer as many as I can. If you're somebody who's going through fertility treatments and have questions, because I'll be happy to answer. I had a lot of questions going through it, and I'm more than happy to help the next person that is experiencing that. So like I said, as soon as you find out that you're pregnant, you're technically 4 weeks along, and I had been reading that morning sickness was going to strike around 6 weeks if you're going to get it for most people. Everybody's different, and I'll prove that by telling you everything that I went through. But everybody's different, but I was kind of starting to expect it around the 6-week mark. And exactly 2 days before I hit 6 weeks, the morning sickness hit. I can tell you that I had super severe morning sickness. And I just want to preface this whole video by saying I am not trying to complain about my pregnancy, that I'm not grateful that I'm pregnant, because that is so far from the truth, it's not even funny. But I went through a lot in my first trimester, so I'm not really complaining, but I'm just telling you how my pregnancy was, because some people have it so much easier, some people have it so much harder, and so I kind of feel like I'm maybe on the in-between. But for me, it seemed really severe, so I'm just gonna tell you like it is, let you know what happened to me. Okay, so morning sickness hit at 6 weeks. And then at 7 weeks, we went back to our fertility clinic for our very first ultrasound. They got to confirm through ultrasound that our baby was in there. We actually got to see the heartbeat, hear the heartbeat, and that's not common with a normal pregnancy. They normally don't look for the heartbeat and all that early. But because a fertility clinic, you know, their equipment is much more advanced. They were able to see and hear the heartbeat, and we got our first ultrasound photos, and it was just amazing. I've had a million ultrasounds at the fertility clinic, and this was the first one where there was something in there, so it was super exciting for me and my husband. We met with the doctor after that, and he released us. He said, everything looks great. You're released to your regular OB doctor. And he said, when your baby is a year old, give me a call and we'll start trying for that second one. So he said, adios, I don't have to see you again. So it was an exciting day. Still in that 7 weeks, like I said, I was going through my morning sickness, and it was so bad that I actually went to the ER in my 7th week for dehydration. My symptoms that prompted me to go to the ER were that I was not urinating very frequently. It was very dark yellow. Obviously, I was throwing up and not keeping a lot of fluids down. And I was also extremely lightheaded. And so I called my OB to see if I should go ahead and go to the ER or just wait till I came to see her, because I had an appointment with her very shortly after this. And she said, if you're already feeling lightheaded and all this, then just go ahead and go to the ER. So in my 7th week, I went to the ER and got 2 bags of fluid for dehydration, and they prescribed me Zofran for my morning sickness. And so I went and got that filled and started taking it, and let's just say that it kind of helped with the morning sickness, but not really. And the side effects of the Zofran were worse than the morning sickness at that point. This might be TMI for some of you, but it caused horrible constipation, and that was the #1 thing that I had go on. And #2 were the headaches. Oh my goodness, the headaches that it gave me were nearly unbearable. So I got off that as soon as possible, and my OB prescribed me Phenigrin, and she gave it to me the oral form, the tablets that you take orally. So that was much better, not as many side effects. I know some doctors don't prescribe that anymore for certain reasons, but mine said that it was safe and that that's what she prescribes, and I trust her fully. So I started taking Phenigrin, which it probably took the edge off some of the nausea, but really and truly, it's not a cure-all pill. So if you see me looking down, it's because I have notes here. You know, this is a lot of weeks to cover, and I had to write it all down and look at my calendar and see what all happened. But from weeks 7 to 10, not a lot went on except the morning sickness. I will say during all this morning sickness time, I was not going to work. I was on the couch. I couldn't move. I couldn't go get something to eat. My husband was incredible throughout all this because he fed me. He made sure that I had a drink before he left for work. He would come home at lunch to make sure I was fine, because I was basically bedridden on the couch and couldn't do anything. And I know a lot of you have to just push through and you can't not go to work, but with mine, they're lenient, and I was able to stay home through the worst part of my morning sickness, and I'm so appreciative, because I don't know that I could have done it. If I'd have been anywhere else, I probably would have quit in my first trimester, and I don't mean that like being dramatic. I mean, I literally would have quit my job because I felt that bad. But on the 10th week, I went to the ER for the second time in my first trimester, and that was because I was having dehydration symptoms again, on top of heart palpitations. I would feel like my heart was racing and about to beat out of my chest. There were several nights that I did not sleep a wink. I didn't sleep at all, because when I would lay down, my heart would just pound out of my chest, and I was lightheaded, and I just couldn't sleep because my heart felt so weird. And I didn't know what to do. It was bothering me so bad that I just had no idea. I thought, okay, maybe it's related to dehydration, because you can feel really weird when you're dehydrated. So I was like, all right, we're gonna go back to the ER and get some more fluids, because I'm so tired of feeling this way. You know, to have these heart palpitations and not sleep while you're having morning sickness and throwing up and can't keep any food down. It was just miserable for me. So we went back for the second time. That time I got 3 bags of fluid, and it really didn't even seem to help the heart issue anyway. So I thought, okay, well, that's not what this is. It's not just dehydration, because that night when I got home from the hospital, I still could not sleep from my heart pounding. So I made another appointment to see my OB to see what I should do. We'll get into that appointment, but the morning sickness for me peaked at 11 weeks, and people will say different times that there's peaked, but I can say, looking back, that the worst week was probably weeks 10, 11, maybe even 12. So that time span right there is when the morning sickness got the absolute worst. I was throwing up, like up to 4 times a day. Every time I moved, I would get so nauseous that I had to throw up. So that's why I just laid still on the couch to keep me from throwing up. I couldn't keep a whole lot down. So that's definitely, I was nauseous 24/7. So that's when it peaked. That's when it was the worst, just to let you know. So in my 11th week, I went to see my OB, and he suggested, for precautionary reasons, that I go to a cardiologist. He just wanted to make sure that everything's all right. He said that my blood pressure was good. I was a healthy young woman, so it shouldn't be anything too horrible. But, just to be on the safe side, everybody wants to be on the safe side with the pregnant woman. So they sent me to a cardiologist and got that appointment scheduled. I guess it was that same week that I went to the cardiologist, and he wanted to put me on a heart monitor just to see what my heart was doing exactly. I told him all of my symptoms, but when you're monitored 24/7, they can see things that maybe you don't even know is going on. So I got put on I think it's called a Holter monitor, and it's a little square about maybe this big, about the size of a pretty big cell phone, and it will clip on to your belt like a pager if you want it to, but it had wires and like the little what do you call them? They're the little round sticky things that they put when you have an EKG. They'll stick those on you with the little lead wires attached, and they'll monitor your heart 24/7. So I got put on one of those to see what was happening, and he had me on that for, I believe, a week the very first time. You notice that I say the very first time? Yeah, there's more to come. I'm telling you, it was pretty intense. So before the week was even up, the nurse called me and said, the doctor is seeing your chart's going all over the place. Your heart rate is spiking, and he wants to put you on medication immediately before he even sees you, to get your heart rate back to normal. So what was happening is my heart rate was spiking higher than it should have, even when I didn't know, because every time I had a palpitation or felt symptoms, I would record it on this Holter monitor, and it would be sent to the doctor. But also every time that my heart rate spiked, the people monitoring me would send that information to the doctor. So I was told by the doctors at the clinic that they got calls on me all the time, and that they were joking, oh my goodness, we're getting another call on this girl again. Who is this girl? So I kind of felt bad that they were like on call 24/7 taking calls about my heart rate, but I was so miserable that somebody should have been miserable along with me, right? I don't know if that's mean or not, but I got put on a beta blocker, and it is just something that will keep your heart rate at a normal rate, because I think normal is like, what is it, like 70, 80, maybe even 90 beats per minute. And mine, even when I was doing nothing, just laying there, would spike up to 140, 150, and then when I was puking my guts out, it would spike up to 180. So they wanted to get it to where it was down in the normal range, and it is kind of controversial to be on a beta blocker while you are pregnant, But it's one of those things that the doctor will tell you, if the benefits outweigh the risk, then you want to take the medication. If the mother is not healthy and everything working properly, then there's no way that the baby is going to be healthy. So they want to take care of me first and then, you know, watch the baby. So I will say that I was nervous at first to start taking this medication because I don't like taking anything when I don't have to, especially being pregnant. But I'm on a very, very low dose that made me feel a whole lot better. I mean, it's a super low dose of this beta blocker. Plus, I have been going to see a perinatal specialist to keep track of the baby and to make sure that everything's on point and that the beta blocker is not affecting her in any way. So, and yes, we're having a girl. I guess there's not going to be a big surprise because I'm so far past that. But it's a girl. I'm so excited. I've always wanted a girl first, and that's completely off subject. We'll talk about that when we do, you know, when we did the gender reveal and the anatomy scan. But I had to throw that out there because I said her. So the cardiologist, even though he put me on medication, he sent me to an electrophysiologist, which is also a heart doctor, but they specify in the electrical system of your heart. Once again, I'm not going to try to explain because I don't even have a very good understanding, but he's more of a specialist, and I don't even know what to tell you about that. It was a 5-minute visit. He didn't really seem to help me at all. He said, drink more fluids, eat more salt, and gain some weight. I'm like, look, man, I am puking my toenails up, and you're telling me to eat more, gain weight, that's all that's wrong with me? I know that's not all that's wrong with me because, you know, I had fluids that didn't work. The cardiologist doesn't think that that's all that's wrong with me, is that I'm dehydrated. So he was pretty dismissive. I was in and out of there in like 5 minutes. So I'm not sure that he helped me much. And then he also sent me to a endocrinologist, which is a doctor that deals with hormones and thyroid, and what they wanted to do was check my thyroid and make sure that it wasn't acting up and causing these heart palpitations, because a lot of times in pregnancy your thyroid can get messed up and it can cause you symptoms similar to this plus some. So I did a blood test at the endocrinologist and my thyroid came back fine. So basically they're not finding any reason that I should be having any kind of heart issues. I've never had them before. Before I got pregnant, never had any issue whatsoever. So they don't really know what's going on. Eventually what the doctor said was that it was pregnancy-induced sinus tachycardia. And sinus tachycardia just means that my heart rate is going above normal. Pregnancy-induced is that for whatever reason, the pregnancy is causing me to have these heart symptoms. So they expect it to go away after I have the baby. They will monitor me probably. I don't know if I will do a heart monitor again after the baby's born, but they'll, you know, monitor me and make sure that all of this goes back to normal once I have the baby. So we got my meds completely sorted out, the milligrams that I'm taking, how many times a day that I'm taking it, and I was pretty much symptom-free after we got the meds sorted out. So that is good news to the end of that very long story. Oh, and one more thing about week 13. That is the first time that I actually felt like I was starting to show just a little bitty baby bump. Up until that point, I just felt fat, just a little bloated, like I'd eaten too much, or, you know, just how you look when you look bloated. You couldn't really tell that I was pregnant at all. It was just fat looking to me. So around week 13 is when it finally started to round out just a little, where I considered a baby bump. That brings us to week 14. I still have terrible morning sickness. At this point, I've switched from the Phenagrin oral tablets to the Phenagrin gel that you just like squeeze out onto your arm and rub it in. And so I was having a hard time, obviously, taking pills because I was so nauseous, and putting anything in my mouth was just nauseating to me. So taking that pill was hard to do, and my doctor prescribed me the gel. You can rub it on your stomach or on the inside of your arm or really wherever you want. It just gets into your bloodstream. So it's continuing to help a little bit more now that I got the gel to take the edge off, but I'm still just puking every day. So miserable, and that went through week 14 all the way up until 15 weeks. And 15 weeks is the first week that I started getting some relief and gradually got better from there. So when you read that maybe at 12 weeks your morning sickness will completely go away, I was praying every night for that, and it just didn't happen. I had it up until I was 15 weeks. Okay, so I finally got through all the big stuff that happened to me, the severe morning sickness, the ER visits, the cardiologist, the meds. I got through all that finally. And let's just get down to some of the more like normal things that you might be going through, because you might never even have to worry about all that I went through. As far as weight gain, I obviously didn't gain any weight through all of this severe morning sickness. I actually lost 7 pounds throughout the whole first trimester. And then for my breast, I did not have any boob growth whatsoever. They were extremely sore. It literally hurt me so bad to not have a bra on. I wanted one on at all times. I didn't sleep in one, but as soon as I got out of the bed, where, you know, before I would probably go get ready or go to the kitchen and get breakfast. No, I had to put a bra on first thing and support the breasts because they were so incredibly painful. And this whole time that I'm so sick, I'm thinking I should at least be getting like bigger boobs out of this, but they didn't grow at all in the first trimester, and they were incredibly sore. Another typical first trimester symptom is that you are extra tired all the time. You sleep all the time. You want to sleep during the day, through the night. I was not any more tired than usual, and in fact I had the opposite happen, to where I had trouble sleeping and trouble napping. I never once was able to take a nap during the day, and I had trouble sleeping at night, and some of that could be due to the heart problems that I was having, but I wished that I was so tired that I could sleep through the entire first trimester, because that would have been nice to just kind of sleep it away. But I had the opposite happen to me. So if you're not getting tired like everybody says that you should be, it could be a normal thing. Like I said, everybody's different, and that was my experience. I did have leg cramps. Part of that could be from being dehydrated, but I know that leg cramps are normal in the first trimester. I would have those at night, and my husband would massage my calves before I went to sleep at night, and that would help a lot. Another common symptom is going to the bathroom a lot in the first trimester, and because I was so sick and dehydrated, I know you're going to get tired of hearing about my woes, but because I was so sick and dehydrated, I barely ever went to the bathroom. So that's not a good thing. I'm just saying that I did not have the typical get up and go to the bathroom every hour and 3 times a night and all that. I didn't have that because I wasn't drinking enough, which I should have been, and I wish I'd had that symptom because it would have meant that I was, you know, a little healthier. Now I want to quickly cover everything that I bought in the first trimester, which is going to be fast because I didn't even feel like shopping on my phone through all this sickness. But obviously we didn't know the gender for the entire first trimester, so I couldn't buy a lot anyway. I bought only 2 onesies, and both obviously are gender neutral. The first one is just a little one from Carter's, and it has a little bear in a wagon right here, and it is a zippered footed onesie with little bears on the feet, and it's yellow striped, and you turn around on the butt, there's a little bear. I just thought it was the cutest thing. Once I started feeling a little bit better towards the end of the first trimester, I ran into the store and got this. It took all of 10 minutes, and I could not wait to get back to the car and sit down and puke. I know that's terrible, but I lasted 10 minutes in that store and that was it. But I got a really cute onesie out of it. The other onesie I got I probably ordered this right when we found out that we were pregnant. My due date is Christmas Eve, December 24th. So this is quite appropriate for a Christmas baby. And it's also appropriate if you were born in the 80s or the 90s and you know the movie Home Alone. You will appreciate this onesie. It is a Christmas onesie that says, "Merry Christmas, you filthy animal." And it's just so cute to me. We grew up watching that movie and loved it. And it's a little newborn onesie. It's so tiny, but it's so adorable. And, you know, it's gender neutral being red and it's Christmassy. So this was probably the very first thing that we bought our baby. As far as maternity clothes, like I said, I wasn't showing and I wasn't gaining weight. So I didn't buy a single bit of maternity clothes the first trimester. For the most part, I was in pajamas on the couch for those weeks. So I really didn't need a whole lot of clothes. But the few times that I would get, well, not even few, as you can see, I went to the doctor quite a lot. But for the times that I had to get dressed to go to the doctor, towards the end, my jeans would fit. I could button them, but when I sat down, they just cut into my belly and they just got tight and uncomfortable. Like they fit when I was standing up perfectly fine, but when you sat down, it was just uncomfortable. So the one maternity thing that I bought for the first trimester was this Bella band or belly band. And this is just, it goes over your jeans so that you can leave them unbuttoned and unzipped. Eventually I had to leave my jeans unzipped as well. And this will hold them up and cover up, you know, your unzipped jeans. This one is called B-Band by Ingrid and Isabel. And I got it in a size small medium from Target. So you can find these just about anywhere, any brand. It's just a nice stretchy material that you know, step into, pull it up over your jeans, and it will hold them up like that. So I got a lot of use out of this the end of the first trimester and the beginning of the second. So this is the only thing I bought. As far as shirts go, I just wore some of my well, actually, I could wear any of my regular shirts. If they were tight, it didn't matter. I didn't feel like I had to hide in, you know, the belly anymore. But they were still long enough because my belly wasn't out there yet. We're going to move on to first trimester must-haves. These are just a few of the things that I could not have lived without during that first trimester. Like I said, I wasn't going a lot of places, so there's not a lot of things that I just had to have. But I'm going to share with you a few of the things that you should know if you're going through some severe morning sickness. These are the things you should think about getting. First thing is a manual toothbrush. I was using a electric toothbrush, like a Sonicare toothbrush, and I quickly learned that all of that vibration in my mouth only made the nausea worse. As any pregnant woman will tell you with morning sickness, brushing your teeth is hard to do. You would think it's such a simple task, but man, is it hard to do while you're pregnant. Especially, I mean, I couldn't even attempt to brush my tongue without gagging and then throwing up. So all of the extra vibration of the electric toothbrush was just too much to handle. So I had to switch to a manual toothbrush, and it really helped a lot. You can control how slow you go. You can control how hard you're pressing down. It's just more conducive to a nauseous pregnant woman than a big vibrating toothbrush. So I would say go get you one of these if you're having morning sickness. Secondly, I was feeling so incredibly bad that skincare just went out the window. Something that I worked so hard on before I got pregnant was my skin, and as soon as I got that sick, it just went out the window. Last on the list, my priority was getting in the bed and getting laid down as quickly as possible at night. So I couldn't have lived without my makeup wipes. I wasn't wearing makeup obviously every day, but you want to just wipe off the dirt and oil and sweat of the day. So this, I mean, you could lay in the bed and wipe your face with a makeup wipe. So I rarely ever used a face wash or anything like that where I had to be standing up over the sink spending time. No. wipe my face as quickly as possible with a makeup wipe and get in the bed. So these are the Olay Fresh Effects Everything Off Deluxe Makeup Removal Wet Cloths. Lord have mercy. You can tell I'm out of breath. You can tell I'm pregnant, can't you? But they have honeysuckle and white tea in them. They smell really nice. The scent doesn't linger too long. They were just a really nice makeup wipe, and you know, they weren't very expensive because I was going through them quite a bit. Now for the days that I did wear a little bit of makeup, I would put on just a little bit of tinted moisturizer and mascara for my doctor's visits because I just didn't want to look like, I already looked like death warmed over, but I just wanted to look like death when I went to the doctor, not death warmed over. So I would put on a little tinted moisturizer, and mascara I would say get waterproof, because I don't know about you, once again this might be TMI, but when I throw up, my eyes water, my nose runs. I mean, just I'm throwing up so hard that, you know, all the fluids are coming out of my face. I know that's so gross, but I had to have waterproof mascara because otherwise when I was out going to the doctor, sometimes I would throw up before I got there, sometimes after, sometimes during. I mean, I didn't want mascara just running all down my face. So I put on a waterproof mascara every time that I put on makeup to go to the doctor. And my last tip is that if you are getting sick and you are traveling or in the car, my suggestion to you is to take grocery sacks with you. Like from your local grocery store or Walmart or wherever you shop, you know, the plastic baggies. I had several in my car. I had one in my purse, and that's just because if you can't pull over fast enough or you don't have a trash can available, I mean, you're in your car, you have something to puke into that you can just tie off the top and wait till you get to the next gas station and throw it away in the trash can. So I had one with me at all times, and I cannot tell you how often they came in handy because you don't want to be puking on your carpet in your car. So just be sure and have something that you can take with you. I just enjoyed the disposability, is that a word? The disposability of a plastic grocery sack, and the fact that you could tie off the top so that it's not spilling in your car and you're not smelling it any more than you have to. This video is just going to be so much TMI. But anyway, the grocery sacks really came in handy if you are getting sick. As far as like keeping from getting sick in the car, I had something to munch on, something to drink. I would find that leaning back in my chair would help just a little bit to where I'm not like staring the road down. For those of you out there going through this right now that think that it's never going to end, that you are going to die from all of the morning sickness, I promise it gets better. People told me that all the time, and I just wanted to choke them because I felt so bad. I didn't want to hear, oh, you'll be fine, it gets better, it's all worth it in the end. I know it's worth it. I know when that baby girl gets here, it's all going to be worth it. But when you are in the throes of your worst morning sickness, hearing those things don't really help. But I'll be the next one to tell you, just keep counting down the weeks. It will get better. So I'm here as one more example of somebody who has made it through. And believe me, I didn't have an easy time. So I know what you're going through if you're experiencing morning sickness right now and watching this. I think that's it for my first trimester. I'm sorry that this video was so incredibly long, but I had so much to cover. Like I said, I'm already 24 weeks, so I've got to get caught up. Now, once I get caught up, I will, you know, put one out every couple of weeks so they're not quite so long and quite so much hasn't gone on in that time. But there's a lot of stuff that happened to me once again in my second trimester that some of you might like to know. So me being a, you know, kind of a different case, I feel like some of you might be interested. And on top of that, I just want this as like my personal diary to look back on, and one day my daughter can watch this and see what my pregnancy was like. So I think it's really neat just to have this personal video diary of my first pregnancy. And once we get caught up, I can start showing you bump updates. And I have a couple pictures from, you know, the second trimester that I can show you that I took, so you can see how it's progressed. But you can see the bump is coming right along for being 6 months pregnant already. I can't believe I'm already 6 months and it'll be here before you know it. But thank you so much for watching. I hope that some of you found this helpful. If you have any questions or comments, leave them down below and I will try to answer everything that I can. If you have any questions about the cardiologist, the dehydration, the morning sickness, the IVF, whatever you want to know, just leave it down below. And I will try my best to answer everyone as in-depth as I can, or you can private message me if you'd rather do that. Thank you again for watching, and I'll see you in my next video. Bye.